Hello, Alaska. My name is Katie Doherty, and I am the Associate State Director for Communications here at AARP Alaska. You are joining us for Fraud Friday, our short video series featuring a variety of Alaskan experts in fraud prevention. Today, I am joined by Janae Larson of the State of Alaska Medicare Information Office. Thanks so much for joining us, Janae.
Hi, Katie. Hi, Alaskans. Tuning in across the state. On today's Fraud Friday, I have the pleasure of addressing Medicare fraud and abuse, how it affects you, and your role in helping to prevent it. The Senior Medicare Patrol, also known as the Medicare Information Office in Alaska, helps empower Alaskans to prevent, detect, and report healthcare fraud, waste, abuse, and errors to help preserve the integrity of the Medicare and Medicaid programs.
Awesome. Thanks, Janae. I know that Alaskans at home are probably wondering, why should I care about Medicare fraud? Can you tell us a little bit?
Yeah, well, Medicare fraud, errors, and abuse really affect everyone. It's estimated that each year Medicare loses billions of taxpayer dollars to improper claims. That puts the Medicare Trust Fund at risk and affects the future solvency of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they can result in higher Medicare premiums and waste really valuable Medicare money that could be put towards other healthcare services. Medicare fraud, errors, and abuse can also cause serious personal consequences for Medicare beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. Medical identity theft occurs when a Medicare beneficiary's Medicare number is misused. This can either be by a provider, a supplier, or by someone posing as a Medicare beneficiary to receive medical care. Such Medicare numbers are considered compromised. If someone finds their Medicare number is compromised, they can be issued a new Medicare number by contacting 1-800-MEDICARE 24 hours a day, 7 days a week. Receiving health care from a fraudulent provider can mean the quality of care is poor, the intervention is not medically necessary, or the intervention is even harmful. A beneficiary may later receive improper care from legitimate providers because of inaccurate medical records. Additionally, because of inaccurate medical records or fraudulent claims to Medicare, the Medicare may be denied needed Medicare benefits. Also, there could be legal consequences for beneficiaries who are complicit in Medicare fraud and abuse, since participating in these schemes to defraud Medicare is illegal. Medicare fraud involves intentionally billing Medicare for services that were not rendered or billing for a service at a higher rate than it is justified. Medicare abuse occurs when providers supply services or products that are not medically necessary or that do not meet professional standards. Medicare fraud and abuse are very similar and many times overlap. Let me give you a few examples of fraud and abuse. Billing for services, supplies, or equipment that is not provided. Billing for excessive supplies or services. Improper coding to obtain a higher payment, or even using another person's Medicare number or letting someone else use your Medicare number to obtain medical care supplies or equipment.
Wow, okay, Janae, thanks. We know we need to look out for fraudulent claims and Medicare abuse. What else should viewers be aware of?
Well, that's a really great question, Katie. Scams are another big part of Medicare fraud and abuse. The coronavirus pandemic has opened the door for a lot of scams. Scammers are quick to jump on any new changes with Medicare and use the information to try and get personal gain. Make sure you protect your Medicare number and only provide it to trusted individuals. Scammers will call and use scare tactics. There's a lot of people posing as Medicare and Social Security. Don't fall for it. If you didn't call Medicare or Social Security first and request a call back, chances are it is not really Medicare or Social Security calling you. Most correspondence will be sent by letter. The newest scam we are seeing nationwide is a vaccine survey. We've received reports of a new COVID-19 vaccine email scam where people are asked to complete a survey. They are offered a free reward, but ask people to pay a nominal fee to cover shipping. Survey scams like this are a creative way for these individuals to steal your identity or money. Many survey scams offer a reward and give you a limited time to respond if you want to take the survey. A legitimate survey would not ask you for your credit card or bank account information to pay for a reward. Scammers know people have received vaccines and are capitalizing on it. Don't give out your sensitive information. Fake surveys can be used to steal your information, collect data about you to use or commit identity theft, or even install malware on your computer if you click that email link. Federal agencies and vaccine companies are currently directing all vaccine recipients to enroll in the CDC, Center for Disease Control V-Safe program, as a post-vaccine monitoring mechanism. There are no other surveys at this time.
Thanks, Janae. That's good information. I know the coronavirus has certainly spawned a lot of scams, ranging from the survey to seeing identity theft from photos on social media. It's scary stuff. What else can Alaskans at home do to prevent Medicare fraud, errors, and abuse?
Yes. Well, first, remember these 3 easy steps: protect, detect, and report. First, protect yourself and your loved ones from Medicare fraud and abuse. Treat your Medicare and Social Security cards and numbers like your credit card. Don't give out your Medicare number except to trusted individuals. Watch out for identity theft. Scam artists will use your Medicare number to defraud the Medicare system. If you find your Medicare number has been compromised, remember, you can call 1-800-MEDICARE 24 hours a day, 7 days a week to provide them that you think your number has been compromised and to request a new number. Be aware that Medicare doesn't call or visit to sell you anything. There are some Medicare contractors that can contact you right now from time to time, so you do have to make sure to be vigilant. Keep in mind, you don't have to talk to anyone who calls you or shows up at your door who you do not trust. If it is a legitimate Medicare contractor contacting you, they will understand. Be cautious of offers for free medical services. If it sounds too good to be true, it probably is. Empower others. Share this information with friends and family members who might not already know how to prevent Medicare fraud and abuse. Second, detect Medicare fraud and abuse. Even when you do everything right, there's a chance that you could be a target of healthcare fraud. There are many ways that your personal information can be used without your permission. Record doctor visits, tests, and procedures in a personal healthcare journal or a calendar. Anything that can help you remember the services, supplies, and doctors you saw or received. Always review your insurance statements. These are called your Medicare Summary Notices, or MSNs. For the private industry, it's called an Explanation of Benefits, or EOB. Look for 3 things on these statements. Number 1, charges for something you didn't receive. Number 2, billing for the same thing twice. And number 3, services that were not ordered by your doctor. Compare your Medicare Summary Notices and Explanation of Benefits and other statements to your personal healthcare journal or your calendar to make sure they are correct. Third, if you detect or suspect fraud or abuse, report it. You will protect other people from becoming victims, and help to save your Medicare benefits. To report your concerns, first, if you have any questions about the information on your Medicare summary notice or explanation of benefits, call your provider or insurance plan to find out if it was an error that they can correct without taking further action. If you are not satisfied with the response or you're not comfortable calling your provider or plan, gather all the facts you can about the situation. Make sure you have your Medicare summary notice or explanation of benefits and any other supporting documentation that shows the possible fraud or abuse. Then contact us, your Alaska Medicare Information Office, also known as your Senior Medicare Patrol, if you need help. The services provided by your Senior Medicare Patrol are always free and confidential. Remember, you can take charge and help prevent Medicare fraud, errors, and abuse in these 3 easy steps: protect, detect, and report.
Thanks, Janae, and thanks for that quick, easy to remember 3-step process: protect, detect, and report. We'll remember that. This has been AARP Alaska's Fraud Friday, featuring Janae Larson of the State of Alaska Medicare Information Office. As always, I am your host, Katie Doherty of AARP Alaska. We remind you to call the free AARP Fraud Watch Network helpline if you or a loved one suspect a scam. That number is 877-908-3360. Again, it's 877-908-3360. If you find that your Medicare number has been compromised, call 1-800-MEDICARE 24 hours a day, 7 days a week, and request a new number. As always, a reminder to stay safe and have a great day. Thanks again. Bye-bye.